Hello, Thrive Nation. Today is all about pain. And I've got an incredible guest, Dr. Perry Nickelston from Stop Chasing Pain. That's his website. That's his Instagram handle. His Instagram handle and his channel is incredible. It's so practical. There's a ton of value that is actually free. And you can get onto his website, chasingpain.com. You can find out about him. He's a chiropractor. But I'm going to ask this question. He's got a whole bunch of workshops. He's a lecturer. He's a trainer, very similar to my other life as a physician, where I've lectured over 10,000 medical professionals. So welcome to the show, Dr. Perry Nickelston. And my first question for you, Dr. Perry, is who is Dr. Perry Nickelston?
How much time you got? Well, first of all, thank you so very much. I'm truly grateful, blessed, and honored to be here. Thanks for the invitation. Well, I'm a work in progress, I guess you might say, like every other human being that's here. Trying to get the stuff that I've been through in my life that I've learned, honestly, through a lot of pain and suffering and hitting rock bottoms that changed and altered my life, not by choice, honestly, but that's where our greatest lessons come from. We usually don't change unless we're really uncomfortable, because why would you? You're comfortable.
Exactly.
That's what pain actually is. Pain is a motivator to change something. And, we don't know what it is, but the body is telling you that something has to be different. Yeah. Sometimes it's just the way you think needs to be different about pain, but your habits and your behaviors. So thank you for the kind words on the Instagram page. I tried to share tips that I call basics and simple and practical and fundamental that people can try and use to sometimes make a profound difference on your life from something so simple. And sometimes it doesn't help, but that's okay. It just means that that's not what you need in this moment in time along your journey. So.
Absolutely. And isn't it human nature that often the seed of suffering is actually the seed to transformation? And it's so many stories. I had Dr. Terry Walls that I interviewed, this physician that got MS, that's involved in autoimmune. And it was only when she got an autoimmune condition, multiple sclerosis, that she look at other ways to treat this condition, treat her pain. It's so incredible that our greatest challenges can be part of our greatest calling and purpose. And so tell us a little bit about your backstory, how you got into Stop Chasing Pain and helping so many people, professionals as well, with all your workshops, and the public out there.
I'd be happy to. And to backtrack a little bit on that, Dr. Walls was on my podcast, the Stop Chasing Pain podcast, and she had a very moving story. And it's so true. She had to open up the way she looked at the world, the lens that she was looking at her own training in healthcare and her body. And that's going to tie in nicely to my story as well. But it's also really funny where, I started to get into functional medicine, the sicker I got. And, that's just more of a holistic way to look at all the systems of the body. And I can't remember her name, but she was a Harvard-trained medical physician, and she got into looking at that as well because she got really, really sick, and the traditional approaches that were supposed to work in Western medicine didn't. And she found her way out of the abyss, and she started to speak with a lot of other medically trained physicians who were in functional medicine. And she asked them the single question: so what got you into functional medicine? Every single answer was the same. And you already gave it. I got sick. So when the spotlight's on you, you really shift. And that's what I want people to get the message out there. We're in healthcare now, that you may not be sick, ... yet, but there's a lot of other people that are in that place. And that's my journey. Like, I've been I don't even like to call myself a chiropractor, because when I do, people put me in a box of what they think that is. And it's about 99% sure you're not going to be anywhere close to what I actually do. So you base it on your own experience with a chiropractor, or sometimes just the stories that you've heard about them. And I don't like labels at all. But I was going through chiropractic and I started to look at the body different ways because I was always beyond chiropractic because I was frustrated with why musculoskeletal pain, for instance, would keep coming back on people, even though we had a lot of great therapies, not just chiropractic, but PT and osteopathy and all those things. And I started to branch out and look at outside the side of pain, right? Imagine that. I mean, that was a big moment for me to say, maybe it's not coming from where it hurts. And that's where Stop Chasing Pain was born. It doesn't say stop treating pain. It says stop chasing it. Chasing it's where whenever somebody points to where it hurts, that's where you go. Right. Exactly. Unfortunately, it's not that easy. And X very rarely, if ever, marks the spot, particularly in chronic pain. In acute pain, maybe, because that's usually traumatic. But, you know, then I started to branch out and look more at the nervous system. Then I started to look more at pain science and brain science, which I still do. But I got something quite different from that in my own illness. I began to get more of an immune system illness. And you're going to see how they all tie together anyway. And I started to get a lot of infections slowly building over time. And people say, what type of infections? Well, you kind of name it. I got it. Like every orifice on my body just getting infected some way, shape, or form. You know, eye infections, ear infections, throat infections, urinary tract infections, prostate infections, multiple bouts of cellulitis, all right, which is a big thing that you shouldn't get. It's not common, all right, especially to get repeated ones of that. And I went through traditional approaches to try to get better because, you know, I needed the antibiotics because I had an infection, and I had to get a couple of surgeries that were part of the process on that. And I kept getting worse, man. Like I was coming out of one surgery worse than the other. And the final surgery, when I woke up, my body just hit like a sympathetic nervous system shutdown, where on the way home, I started to manifest symptoms of a full body candida systemic thrush infection, like as soon as I left the home. And then for weeks afterwards, I could barely function. I had so little energy, so cognitive function, sleeping 16, 17 hours a day and never feeling rested. And I was in a really, really bad place. I hit a physical and mental breakdown, and I had to quit teaching, which is my love. I had to quit practicing because I didn't have the energy to practice. But first of all, I couldn't even put one and one together. I lost a lot of cognitive function and was heading headlong into early signs of Alzheimer's. And I realized that, you know what, I share this story a lot if I have time, where I was coming home from one of my last teaching gigs, and I was teaching for Rock Tape, a kinesiology taping company. And at the time, I had to teach and travel wearing a catheter bag because I couldn't urinate on my own. Wow. And I would teach and I would lay down during lunch and get the energy to come back. On the way home, I was driving home because it was around New York, which is close to where I live. And I started thinking to myself, you know what? It would be really easy to turn my wheel into something, and it's over. And it didn't happen just once, that thought. It happened a lot. You know, a pole, not another car, because I don't want to hurt another human being, but, you know, a pole or an embankment, or just turn it really quick and you'll flip. And so I knew at that point I needed help. So I actually physically placed a call to a suicide hotline on the drive home. And I spoke to someone who talked me back. And, you know, they're obligated to report to the officials if they believe you're still going to be harm to yourself. For all I know, they may have to report everybody who calls. I don't know. But I got home. 30 minutes after I got home, 2 police officers pulled into my driveway, 2 cruisers, and they knocked on my front door. And then that's when my whole family, and my children were younger at the time, and my wife, who's still my wife, found out that that's why they're there. That's a come to Jesus moment, I call it. Where sometimes that right there is enough, is where if you're not doing it for yourself, you're doing it for the people that are around you. And I knew that I had to rescue myself. I had to think beyond the way I've been thinking. It's a classic line of, you can't solve a problem from the same way you arrived to it. And you have to go down pathways that seem kind of crazy, but they're not crazy. You just haven't been led to need to look down them. You know what I mean? The curiosity wasn't there because your life wasn't on the line yet. And that's when I started to look beyond the symptoms and look beyond my approaches. And I began to look more at the immune system, not the nervous system. And then that's when I discovered the tie-in between the nervous system and the immune system called the neuroimmune, which we'll get into later with the vagus nerve, of course. And I came across the lymphatic system of the body, the kingpin of the immune system, and of getting rid of inflammation and whatever's inside of you that may be causing you to get sick to get out. And that was my journey of discovery. That was my transformation, honestly, into everything. All the puzzle pieces fell together. And how I knew it fell together is this. 3 days after one lymphatic intervention, I felt, and I kid you not, 50% better in my symptoms. And then more importantly, in my cognition. And I'm like, okay, there's something here. I'm going to pull this thread, man, and I'm going to see where it goes. And then that led me to, at that point, not really focus on techniques or disciplines, but how things are supposed to work together in the body and why they can't. Like, what's the deal? What's the barrier that we're not seeing? And that's why my passion now is sharing these little trails, it's like a pebble trail leading you down a pathway of, then you go to yourself, holy cow, like I never knew that, or that's so true, or that makes complete sense. And that was the time that I never would have even ventured into looking at the lymphatic system. Because why would I? I mean, it wasn't relevant in my life. The brain only pays attention to anything that's relevant to it. And it wasn't relevant at the time. And then that's where I said, okay, this is my life's calling. This is my purpose. And it just blended perfectly with stop chasing pain. I'll wrap it up in a moment. I was not chasing pain before I got sick. So what I mean by that is if your knee hurts, for instance, I would stop just looking at your knee. And to me, I was like, holy cow, you mean if I look at how well your ankle moves, that just might help your knee? That was, whoa. Or maybe it's the hip above and then the knee feels it, which, by the way, if you have knee pain, you always want to look at the ankle and the hip on which side. Yes, both sides. But I was stuck, man, in one system. I was stuck still in the musculoskeletal system. And the universe needed to say and teach me that, hey, Perry, there's a lot of other systems that you need to look at. And I think the only way you're going to learn to look at them is I'm going to crush you for a little while. Like, I'm going to take you down to where you almost want to quit. Then you're going to find it. And that's the reframe, or what I don't call it reframe anymore. I call it re-meaning. So you can't change what happened to you, right? But you change the meaning of what happened to you. That's where the transformation takes place. So I know I went on for a little while, but thank you for letting me share my story.
Powerful backstory, and how you've taken that meaning and that mantra and just gone to incredible heights. And so, I salute you. I thank you for your role that you play, and far greater than the musculoskeletal system. You're now talking about the lymphatic system that I want to talk about, and obviously the autonomic nervous system and dysregulation of that. But let's define the lymphatic system and the lymphatic system, what it is, and then how people can assess it, or how you assess it. Someone's listening out there. We've got a lot of listeners that battle with chronic pain, and they've seen physical therapists, they've seen chiropractors, they've seen orthopedic surgeons, maybe acupuncturists, they've done massage, they've tried many, many things. And, chronic pain seems to be almost like a stubborn little child. It finds different pathways. And it's a very clever, stubborn little child. It'll find different pathways for you to get to the root or multiple roots. I think there's people are looking for one root, one cause. It's sometimes 20 or 15 or 30 causes, that the body is in terms of not being in homeostasis. So tell us about those two areas before we move on to the autonomic nervous system.
Yeah, that's a great point and great question. Is that one of the reasons people struggle so much with chronic pain is because there's so many factors and variabilities that go into it. And what's crazy about it is those factors may cause you pain, but don't cause me any. And you're like, what the heck? That's why it's so elusive, because we're used to, one or two things of this is it, and this is causing all of your issues. But that's a different model. That's more of a traumatic or infectious disease model, where you've got the criminal that you can find and take out, like Batman. Not so much with chronic pain, but the lymphatic system. So it's a major system of the body, in my opinion, the most important and neglected system that nobody looks at in relationship to feeling better or performing better. So I'm going to tell you what the system is a part of, and then I'm going to give you an analogy to help people understand it, because I discovered a long time ago that if you're trying to explain something that's a new concept to somebody, tie it to something they are already familiar with, right? Okay. Like an analogy. So the lymphatic system is a significant player in your immune system, and it gets rid of things that are inside of your body that are trying to take you out of this earth that you don't want inside of you anymore, from bacteria, all types, to parasites, to viruses, fungus, cancer cells, because it kills cancer cells every day. And also, this is really important, people, your own metabolic and cellular waste products, it gets rid of. Because if you don't get rid of those, you become sick as well. Right? You become toxic to your own metabolic cellular waste. And it's a significant player in your cardiovascular system, your circulatory system, tied to heart health and tied to arteries and veins. Right? So people that have hypoxia or blood flow issues or oxygen issues and pain because of poor oxygen and poor blood flow, you can't treat those systems separately. It doesn't exist, right? No system in the body ever works alone. It never gets injured alone. It never heals alone. There is no such thing as an isolated injury. There's no such thing as isolated healing. You have to look everywhere. So that's a pretty big deal, man, right? And I was like, why in the hell didn't somebody tell me how important this lymphatic system was when I was in school? And people ask me that all the time. If it's so important, why didn't I already know about it? I'm like, well, that's a really good question. Maybe you should ask the people that should have taught you by now. And then when I show them the techniques of how to help it, they go, that's it? Seriously? All I got to do? Yeah, it's just the awareness that it's a thing to take care of. So here's the analogy. There's actually, two of them we can do. Think about a fish tank, an aquarium. So my program is called Body Aquarium Lymphatic Mojo. And if you have an aquarium, hopefully you got fish in there, right? And the fish need to stay alive. Those are your cells, by the way. So think of your cells as fish. The cells in the fish need oxygen, right? And they need nutrients, and they need water that circulates, and that's the little filters you see up in the corner where all the bubbles are happening and the water circulates. And then the water looks great, and you have all these different chemicals to keep your pH well, and you can look to the fish tank and the fish are happy. But what happens if that fish tank filter system that you don't see, it's tucked underneath the cabinet out of sight? If that starts to become dysfunctional, you don't see changes immediately in the tank, right? But over time, over days, over weeks, this thick tank doesn't look so good. The water's a little bit murky, and I see stuff growing along the glass. What do you think that is? Well, those are toxins, man. That's bacteria and viruses and fungus. Same thing starts to grow inside of you. when your filter system doesn't work well. And then all of a sudden you see the fish get stuff growing on their skin, right? And then meanwhile, you keep dumping food in the damn tank. And so you keep dumping food into the tank and you're making the water even more toxic because the food you're putting on in, and the fish are swimming in what? Their own waste. Because they pee and they poop in the tank, right? Well, guess what? That's what your cells do too. Your cells pee and poop all the time. It's called a metabolic Krebs cycle process known as recovery and regeneration, right? Or autophagy. And so you need to clear that waste out of your fish tank. And then if you ever look at a fish in a tank that is really struggling when there's low oxygen in the tank, you see the fish do this. I don't know if you're not on video, but I'm really big mouth. They're dying. They're slowly dying from hypoxia. Your cells do the same thing. Right? Sure. And so what I ask people is like, let me ask you a simple question. How would you ultimately help that tank? You could go in there and I could take the water out and I could clean it and I could put all new stuff in there and go to the store and buy all brand new fish. Looks great, right? That's the medical approach. Then what happens 2 weeks later?
Same story.
Same damn thing. Then I'm like, okay, well, why don't we think a little bit deeper? What would you really want to do first? Well, change the filter system. Make sure the filter system works well. Because if that filter system works well, I don't care what you do to the tank, it ain't working. Right? Now, it might not be the issue, but you better check to make sure that it's not. Because if it's not, well, then you put it aside. You're okay, check the box. The filter's not an issue. But if it is, it's one that if you neglect, no other therapy, in my opinion, is going to get you to where you could be. It'll help you a little bit, but it's going to keep coming back. And that's the proverbial question I've always wanted to ask. Why does stuff keep coming back? Well, maybe you don't have an environment that's conducive to healing because your body just can't do what it's trying to do. Does that make sense? Absolutely. So that's the play. And then another way to look at it is like, and this will tie into the lymphatics. So, you know, the lymphatics are all through the body. It goes everywhere. You've got over 600 to 700 what they call lymph nodes. And lymph nodes are like mini toilet systems that you flush in your house. So those nodes take in metabolic waste, they take in things, and that's where your immune system is like a grocery store. It scans the barcodes of all the toxins to see what the immune system needs to release out in order to kill it. So it's the groundwork for your immune system response. Right? And you got 600 to 700 of those things. And depending on the size of the person and the research you read, most of the lymph is located in 3 places. Your skin is number 1. And number 2 is going to be in the neck. Of the 600 lymph nodes, 1/3 of that number is from the neck up. So what does that tell you? Neck's pretty damn important in relationship to the lymphatic health everywhere, and in particularly your brain health. And the biggest place lymph is located is where 70 to 80% of your entire immune system resides, and that's in your gut, in your abdomen. So if you have a lymph problem, you have a gut problem. You have a gut problem, you got a lymph problem, in my word. Hard stop, period, 0 debate. I just have to figure out how much when we do it, all right? So those are mini toilets. Every time a toxin goes through one of those toilets, it flushes, and it's going to flush, it wants to get it out of the system. And it goes out of the systems for you like everything else, through your pee, through your poop, through your sweat, through your breath, all those sorts of things, okay? Most of your body is designed to detoxify waste, all right? And the lymphatic system is in the brain. Right? Now, brain stuff is really cool because up until a short time ago, they didn't think that the lymphatics had anything to do with brain health. And now they know that they really got it wrong on that one. That's a big whoopsie-daisy, man. That's a big miss. So you've got the lymphatics that are in the neck, and you got the lymphatics that are up around in the brain that are called the meningeal lymphatics. But then inside the brain, you have what's called glial cells. And glial cells are cells in the brain, not neurons, but they're glue. They call them glial, means glue. And it's too much to get into a lot of what they do, but you got astrocytes, oligodendrocytes, and microglia. Those are the big ones. And you got some swans in there, but those are the big ones. And those are the ones that will help clean out the toxins in the brain. And that's like flushing the toilet in your house, in your brain. And then, you know, when you flush your toilet in your house and then it goes out into a bigger pipe and into a sewer. So when you have the ones in the brain, the glial cells, that's flushing the toilet in the brain, and they have to flow out to the big sewer pipe. And guess where the big sewer pipe is? In your neck. That's the neck nodes. The neck nodes. And then the neck nodes drain down into, and the lymphatics ultimately dump into the cardiovascular system near the heart at your veins. So everything goes back to the veins regardless. So the moral of the story is that you're not going to have optimal brain health if you don't have optimal lymphatic health from the neck down, because both systems are beholden to each other, right? That's kind of a big deal, man. That's really important to know. And here's one of the reasons why, when I discovered that, why I felt 50% better in 3 days, and why my brain fog and my neuroinflammation in the brain got better, because now my brain toxins could flush and they could get out. So now my neurons could begin to what they call wire and fire, because they need to have an environment. They need to have a clean fish tank. Dude, you don't want a dirty brain fish tank. That's not going to turn out well. And here's the cool part, man. They know that pain is in the brain. You know, pain is an output signal, not an input signal. So you don't feel pain signals coming in. You have sensory signals coming in called nociceptors that are threat signals. Then your brain interprets it as an output signal as pain. So if I know that how well the brain functions determines on how pain is for you, you might want to make sure that the environment that those neurons fire in work well, because maybe you're stuck in a pain loop and can't get out because you have a tank that's filthy. So lymph and glymph, in my approach, in my opinion, is always, and I'm going to stand by that until I'm dead, always tied to chronic pain in some way, shape, or form. How much? I don't know. I just know it's going to be a puzzle. Why? Because these systems cannot be broken apart. Does that make sense?
Absolutely. So tell us, what did you do to get 50% better within 3 days and treat your lymphatic system?
Here's the coolest thing, man. Like, the only thing I did was assess the primary lymph nodes in my body. That was it. Why? Because what happens with the lymphatic system is the lymphatics need to move primarily through a few mechanisms. One is through human movement. So the more you move of yourself, more often, more ways, more environments, you pump lymphatics, right? So, and a lot of people don't move, but I was moving a lot, man. I've been moving and training since I was 14. So I'm like, okay, well, that wasn't a part of releasing it for me, but it's important because you don't want to just sit all damn day. And then the other one is breathing through the diaphragm. You know, not necessarily your lungs, but your diaphragm, which is a muscle that sits in, that separates the thorax from the abdomen. It's the bottom part of the rib cage. And when that muscle contracts, it pushes your organs to the floor. And then when it relaxes, the organs pull up from the floor, you know, like a piston. Holy cow, just like a pump, right? And it pumps the organs and it pumps the lymph. The largest lymph node in the body sits 2 inches above your 2 to 3 inches above your navel. And it's blocked in most humans and they got no idea until I stick my fingers in there. Then you know, because it hurts. And then most people don't breathe through the diaphragm. They breathe through the mouth, they breathe through the chest, they breathe through the neck, they breathe through the lungs, and they're all tied up top, you know, choking off the drain points right from the get-go, or they don't breathe at all. Like, because they're just so wound up and so stressed that they hold their breath and don't realize they're holding their breath, or they're over breathing too much through the neck, and they're causing stagnation that way. But I was doing both of those, and I'm like, well, then why is it a problem? Sometimes the blockages are too much that those are no longer enough. Like the filter can't clean itself anymore. It's too blocked. You have to get off your rear end, open up the filter, take it out and change it for your fish to survive. That's the same thing with you. You need to go in there and unblock the nodes. How do you block the nodes? That's simple. You use your hands. It's the best way that I know how to do it. Okay. And then you just go and assess over where the primary clusters live. Okay? Because here's the thing. In all the years that I've been pressing on tissue, I never ever envisioned pressing on lymph nodes. I was pressing on stuff, but I was pressing on muscle and fascia and nerves, not realizing, you know, there's a lot of lymph nodes underneath this too, brother, right? Mm-hmm. So it just wasn't in my mindset. But it's not just arbitrarily rubbing nodes. You gotta rub them in the right order and in the right sequence in order for stuff to flow. Because it's just like water flowing down a mountain from point A to point B. It knows where it needs to go, but it's got many different places that it can become blocked, right? And here's the cool part, man. Your body is really well designed, and nature is pretty damn smart. Like, it's whatever you want to call it. Nature, universe, God, Buddha, Zen, I don't care what you call it. That it says, you know what? I know that movement moves lymph. Where can I put these lymph node clusters so they get a lot of movement? Answer: around the primary joints of your body that are supposed to move the most. The shoulder joint, the hip joint, the knee joint, the upper part of your neck where your skull attaches to your spine, and holy cow, the middle of your abdomen, which is your rotation point when you walk, as long as you're not walking with a damn cell phone, right? So all of those areas, those are places where people get really, really tight and really, really restricted. Why? Because they sit all the time. Or when they move, they do lots of linear movement, front to back, right? They don't do a lot of rotational movements. They don't do a lot of walking. And then here's what's even more cool. Those nodes sit around areas where you have big pipes of vascular flow and big nerve trunks. So everything that goes into your fingers and your toes and those small little arteries and veins and nerves, they come off super duper uber big ones, man, higher up. And if the higher up ones and the bigger ones are not happy, those ones in your fingers and your toes, there's no way they're going to be able to come back, right? So it's the design of the body is critical. And when you understand that relationship, you know exactly where you need to go and what you need to do. So I just told you the primary places that you can assess on everyone just on your own. And I'll be happy to go through them one by one now, if you would like.
Yeah, absolutely. Yeah, give us the main ones, because we still got to be running. I want to get into the autonomic nervous system. You've got so many good vagal tone exercises, but give us the main ones, what helped you in your own personal story.
And you want to check the Winbox bonus moment here? The places that I'm going to show you to check first are two of the biggest places to stimulate the autonomic nervous system of your vagus system. How sweet is that, man? Right? So what we know is that the lymph drains based on pressure, right? So the lowest pressure for lymphatics and the dumping point, the ultimate drain point, is above and below the collarbone, right at the collarbone. So that drains into what's called the subclavian vein. Sub means below, clavians for clavicle, subclavian vein. So the first place that you always check and stimulate is above the collarbone, right there. And you always look for puffiness or swelling on either side. Right? Most of the body's lymphatic, 75% of the lymph in the entire body, drains to the left side of the neck. So it's usually the side with the bigger issue, but not always. And then the remaining 25% of the body drains to the right side, but you always check both sides. So if you just rub above your collarbone right there in front of your trap and above the collarbone on both sides, when you rub it, you stimulate it and you start to free up tissue, right? So that's always number one, always. So I start there no matter what I do for anyone. Right? Number two is higher up. It's if you go up at the top of your neck, right behind the angle of your jaw, right in front of that big bone at the top, what's called your mastoid process. There, some people know that is cervical 1, cervical 2, right? Atlas and axis. There is the largest lymph node in the neck. And it's also where the vagus nerve descends out of the brain into the neck to go down to your abdomen. So you rub the left side and you rub the right side, pressing, up and down in circles, and just rub right there. And notice if one side feels more puffy, tender, or swollen, or different than the other side. And you just stimulated your vagus nerve at one of the biggest choke points of the vagus nerve. And you also did it down at the collarbone, because that's where the vagus nerve goes down before it wraps around your esophagus behind your sternum. So that's number two. Number three is right at your shoulder joint. So put your fingers right where your pec joined your shoulder and what's called your pectoral or your axillary. Now that's the area that women get a lot of issues, right? With the breast tissue, with breast cancer, breast implants, breast explants, things like that. So a lot of stuff happens here. Then do the other side, right? And you just grab it a little bit, move it around. And people say, how hard? I go, yes. And they go, which direction? I go, yes. Don't overthink it. It's not rocket surgery. You're just moving it around, right? Then number four is the abdomen. So I usually tell people to find the space. So if you put your finger in your belly button, and then you put the other finger at the bottom of your sternum, right at what they call the xiphoid process, or the top of your rectus abdominis muscle. I want you to find the space halfway between the navel and the bottom of the sternum, and stick your fingers right at the halfway point and just rub up and down, back and forth with your fingers, okay? And that's usually where you'll find the largest lymph node that sits. Now, number five is the crease of the groin. So those are what they call inguinal lymph nodes. So you just find the crease of your groin on both sides, the one you find when you sit. I'd rather you release this preferably when you're standing, but you go all along the line of the crease, above and below. Mostly it will be below the crease. And then go on the other side. That's a big choke point, your femoral nerve and your femoral artery and vein. Okay. And then the last one, number six, is posterior knee, called popliteal fossa, behind the crease of the knee. So you put your fingers behind the knee on both sides, right at the crease, and go a little above and a little bit below. That's a big one because a lot of people get puffiness behind the knees when they have circulation issues and lymphatic issues. And that can cause a lot of problems with the calf, with the shin, with the foot, with the plantar fascia, with the knee, also different things. Puffiness behind the knees is an indication of a significantly compromised lymphatic and vascular system in my world. And you do those right there. That's all I did. Or actually somebody did it to me because I had no idea about the lymphatics. And then, somebody said, I think you have a lymphatic system problem. And I go, lymph what? What? Because at the time I was really having a lot of issues with sinuses and postnasal drip and clearing my throat, because I had so much of my immune system laying down mucus for protection. And that's what we call MALT, mucus-associated lymphoid tissue. And it was really annoying for people because I couldn't stop sniffing and I couldn't stop clearing my throat. And that actually cleared up too within a week. I wasn't able to breathe through my nostrils for 3 years.
Wow.
Because of the mucus, which made me have to breathe through my mouth. And then I was breathing through my mouth, which shut down what? My diaphragm pump. And so everything was just feeding off of each other. So that was it, man. Like I just put my fingers in all those places. And I have to tell you, the person who did it to me, I love to death, but I call him Satan because their pressure was really, really hard. And every single one of those areas hurt more than the other one. I was astounded by by how much they were tender. And I went through a little bit of a detoxification. So I want to prepare people that may have done this now or are going to do it. When you do that, you're going to be releasing, crap in your lymph nodes that it has wanted to get out, but have not been able to get out. And now you're moving it along and you're helping it get out. So your immune system is going to have to deal with that. Right now, you may go with a little bit of a detox. And I always tell people to prepare for this. It might not happen, but if it does, it's normal. Don't get nervous. Better out than in, I say. And a detox feels like a rough Saturday night, man. Tired, fatigued, lethargic, headache, sometimes a little feverish. Pains get worse. Old pains come back. New pains show up. Just roll with it and realize that that's okay. It eventually will subside the more you do it. Now, that's just a beginning phase. I mean, there's a lot more levels you have to do. You have to go deep. You have to work with organ lymph. You have to do the lungs. You have to do the liver. You have to do the spleen. And you got to do the intestines and all those things. But you have to work up to those. You can't just arbitrarily. That gave you the baseline. So everybody can start with that.
And everybody can start with that. And the frequency, is it once a day? Is it twice a day? Do you use essential oils? There's a lot of thinking of using ozonated olive oil in these areas while you do that lymphatic massage. What are your thoughts on frequency and any topical agents?
Great question. First of all, less is always more when you're beginning in a new therapy program. One of the reasons that things don't work is people do too much at once. They overload the system. Right. So you start with once a day only, and you see how you feel. Right. Because some people may say, I felt awesome the next day. I want to do it again. Then by all means. Then another person will wake up the next day and feel like they got hit by a truck. And I don't want you to do it again, because you have to let your body recover from what you already did to it. And you don't want to overload it. So it all is based on how often you do it, is based on your response. So if you feel really good or you feel a little tired, then you can do it every day once. You can do it more than once if you want to, but it's not always necessary. But if you don't feel good, you have to take a break until you start to feel a little bit better. And then you go into it. And essential oils, you have to be careful of too, because those are really powerful therapeutic agents. And a lot of times people can't handle essential oil, even though they're great. But you don't want to put them on every single spot either. You start with one. And then the single spot that I tell people to start and try with essential oils is at the top of the neck at C1 and C2. Because you're going to get your vagus nerve there quite nicely, and you're going to get the largest lymph node in the neck. So that's a really, really powerful spot. That's one of the biggest locations where the vagus nerve gets impacted in the body, is at the skull to the cervical spine.
Okay, now how long do you rub for? And do you have to do it in a sequential order? Do you start just above the clavicle and then you just do, below the mastoid process?
Yeah, you always do it in the order that I just taught you.
Okay, great.
So it was 1 through 6.
1 through 6. How long do you?
Never, ever reverse that order.
Okay, brilliant. And how long do you rub for?
How long? I said before, here's the thing. You can't give rules to individuals. You can give concepts and principles to individuals. So I want you to start rubbing lightly first. You don't have to go hard. And then start just with 5 to 10 seconds each, right? And then people say, which way do you rub? Well, my answer is, which way do you think your tissues move when you move? Every damn direction you can think of. So you move it left, right, up, down, diagonal, circles. Circles work really, really nice, clockwise, counterclockwise, but you move it like tissue moves, which is everywhere. Right?
Good. And what can people do in combination? I've got a rebounder, I've got a trampoline, I do infrared sauna, I do brushing, which I think is very, very important. Things that they can do at home, or sunlight, or sweating in the sun. getting that, that beautiful natural electromagnetic radiation that comes from the light spectrum. What can people do, or supplements like EDTA, chlorella, spirulina? What else can they do to supplement the sort of the detox program, from the lymphatic system?
Good question. I don't typically give nutritional advice to people because not everybody responds well to the same supplements or food. It's highly individual. And plus you have to remember that even good food and good supplements become toxic when they can't get out after your body absorbs them. So, we usually go way more into certain recommendations when we do our courses. But the one thing that I typically tell people that they want to start with is kind of a ground zero, what I call cake mix. Like can't make cake without cake mix, or some types of trace minerals, fulvic, humic, or shilajit minerals, because most people are really deplete in minerals content. And you're going to have a really difficult time completing enzyme reactions in the body without minerals, because enzymes won't work without minerals. And if you've been under a lot of stress depletes minerals. So that's one of the biggest things that I tell people to do. And of course, make sure that you're hydrating yourself. And rebounding is, all those things are magnificent. The only thing that I would warn people is don't do all those things at one time, because too much of good things can overwhelm an autonomic nervous system that's under duress, because everything you do to your body is a stressor. Because stress isn't bad. You need stress, because without stress, you can't become stronger and more resilient, but you have to adapt to the stress. You don't get stronger during the stress, you get stronger after it, as long as you can recover from it. And that's the fight or flight, sympathetic dominant, always in survival mode, as opposed to the parasympathetic wine, dine, feed, breed one that you can relax. So cells are either in growth mode or defense mode. They can't do both at the same time. And they're always going to choose defense mode first, because you can't grow if you're dead. You follow? So the priority system is that. So rebounding is great, and also brushing are great. But in my world, you never do either one of those until you do those 6 areas that I showed you to do first, right? Because jumping up and down is supposed to do what? Move lymph, right? But what if you got all those choke points blocked off? You're going to be jumping up and down and driving fluid to areas that can't take it. So you can make yourself worse through rebounding. So you rebound, but you rebound second. And same thing with brushing. You don't, in my world, you don't just start brushing. You do those 6 areas first, then you brush. And you never brush from bottom up. You only brush after you do the 6 places that I showed you in my approach. Because why? Because brushing works the superficial lymph near the skin. And the superficial lymph has to drain to what? Bigger, deeper pipes below the surface that might be blocked that you don't know are blocked. So dry brushing is great, but you'll find you might not do so well with it, or you can do better with it if you do the clusters first. Then you do the brushing. Or if you brush the clusters first.
Okay.
You understand?
Yeah, I got you.
That's going to make a big difference right there. That's a huge win if you can do that.
Wow. Okay. So that's incredible. These 6 points are the foundation, of lymphatic drainage, making sure the pipes are open before you start any other techniques. How important is, and Dr. Perry, do you mind if we just focus on the lymphatic system? I just think this is so important. And I don't know, your time is so valuable, and maybe we can go back to the autonomic nervous system and look at.
Dude, I got all the time in the world. You name it. I'm good.
Yeah, that's great. So, because I want to talk about a standing desk, I even know when you interviewed Ben Greenfield, I listened to your podcast, he's on this walking treadmill. I'm a big believer in a standing, sit, stand, move as much as you can, try and get the 10,000 steps in a day. Obviously, graded. No one's going to jump up from 2,000 to 10,000. You want to grade all these things. Same with the lymphatic techniques you're doing, because people are going to be listening to this saying, what do I start with? We know the 6 points now. That's important. Be careful with essential oils unless you've used them. Maybe you can, before we move on to the standing desk, is what about ozonated olive oil? Or if they do want to start with a specific oil because it's dry, where should they progress once they've done the 6 points that'll help them?
Yeah, so those are all great. It's really funny because when Ben Greenfield was on my podcast, he did it while he was walking on his treadmill.
That's exactly it. That's what I said when I was listening. I heard that what happened. I'm still trying to get him on my podcast, but he was walking, so he's getting a lot of movement and standing desk. But tell us about the essential oils. Where do people start with that, or the ozonated oil?
Yeah, so I'll tell you with essential oils. People always ask me, is there a best essential oil for lymphatics? And first of all, I'm not an essential oil expert. I don't like the term best for anything. I like the term different, because the body likes variation, variability, and variety. It's what's called the 3 V's. And my friend Joanne Elphinston, a physical therapist, coined that term. And you can encapsulate that in 2 words: novelty, which the brain really likes, and difference, because they mean the same thing. Because I believe that if you give the body different input, it likes it better than just an optimal one best. Because if you do one thing over and over and over, you get not so great at a lot of other stuff. You follow? I just tell people in relationship to oils, definitely don't just go buy any brand. Make sure you choose a reputable company, or ask around and try ones that you like, and then experiment. A lot of companies have a blend. For instance, they may have like a lymphatic blend, and sometimes they'll mix 2 or 3 oils together. Excuse me. Sometimes people use just an individual one. And honestly, when people have oils, one, you have to be careful that you're not sensitive to them, because some people can actually become sensitive to them and have a reaction to them, especially if you have a poor lymphatic system, because the skin can't detoxify well. And you always want to mix it with some type of carrier oil. You know, if you like the olive, or you like coconut, or, you know, hey, here's a novel idea. How about you pick different oils too, that you mix it in with? And it doesn't take a lot. It only takes one or two drops. But I tell people, if you have oils, I want you to go and pick the one that's pulling you in. What's the one that's you're gravitating towards? Trust that. That's your intuition, right? I want you to go with that first, and then try different ones. And you say, holy cow, you know what, man? When I tried that lavender, my goodness, that was great. Or when I did the frankincense, you have that, you know. I have a company that I work with. They're called Can I say the name of the company?
Yeah.
They're called Alchemist Oils, alchemistoils.com. They have a lot of really wonderful blends, and I like their quality a lot. They actually have a lymph node blend that's quite nice. That's not the only one that I use in those regions. Sometimes they have a really nice sleep one that before I go to sleep, I always rub that on my C1 and C2 here. And I also rub it along next to my nose, along what's called the nasolabial groove, the smile line groove there, because you have a significant lymph node that sits right there in the cheek that comes off right where a branch of your trigeminal nerve comes off, maxillary branch here. Yeah. And if that gets blocked, a lot of people get redness or acne or irritation around the face, but it also irritates the trigeminal nerve. And then so a lot of people get pain in the eye or the ear or the face, or it can radiate up to the other branches of what they call V1, V2, V3, and the branches of the trigeminal nerve for sensory input to the face in that region. And it could be quite nice. And plus it's very close to your nostril. So it sits right here. If you feel along that nasolabial groove and you push there, you should feel a hole in your face.
Yeah.
That's actually where the one of the branches of the trigeminal nerve comes out. And then you can maybe often find that one side is more tender than the other. And it can be, if you pinch your cheeks a little bit, like that, like your grandmother used to do, and see if one feels a little bit more puffy than the other. That can indicate a congestion of lymphatics around that side, or issues that you deal with. And the trigeminal nerve is really important in relationship to the vagus nerve, because the trigeminal nerve has a lot to do with sensory input to the face. So a lot to do with what they call the social engagement system of the body, the ability to, have the eyes and the sensory input, but also mastication, of clenching, the motor component. And that's a big thing in relationship to stress, right? Because people, when they get under stress, they grind or they clench. And they hear. It's also a survival response, because this kicks in as because you can really win a fight quite well if you bite somebody, first of all, but also you'll clench your teeth usually during a fight to prevent your jaw from getting dislocated from a hit. Sure. So that's a primal reflex to clench your jaw.
Wow. Okay. So essential oils, start gently, reputable. Now let's talk about sunlight and sweating, possibly to help your lymphatic system. And then maybe you can touch on infrared sauna that I've found very gentle to start. All these things, anyone listening, go onto the YouTube. We're going to be putting this on YouTube. Go and look at the exercises. Go and see these 6 areas that Dr. Perry has outlined. Start with them. Start gently. Less is more. Of course, this is not medical advice. There's obviously a caveat here. Work with a medical practitioner. But let's talk about light and how important that is. I've noticed with a lot of my clients and patients over the years, all this blue light coming on you, being indoor, the electromagnetic field affecting all these neural structures, how, cell phones and the radiation causing trigeminal problems, affecting the lymphatic system. So let's talk about light therapy.
Yeah, well, I love light well, not all light, but, sunlight for the win, right? I mean, that's a big one. And I had Dr. Jack Cruz on.
Yeah, I've had him 3 times as well.
He does a lot with light, and then he tells people, and a lot of other people agree with that, to expose yourself to the sunrise light. That's really probably an optimal time for people to do that. One, because you're up and you're probably ready to seize the day. So you go outside and you watch it rise, and then if you can have your body in contact with the actual earth at the same time, with your feet on the ground, that's even better. And as much of your body exposed to the sunlight as possible, because the spectrum of light waves at that time are shown to be a sweet spot of helping the body recover. And plus, it's a mindset thing to have you get a sense of awe and wonder. And awe and wonder has a really wonderful way of relaxing the fight or flight response. Right?
Absolutely. But he doesn't talk about the relationship between the lymphatic system and light. So it's got a lot to do with mitochondrial function. Yes, obviously that's involved, but there's no direct link from light to the lymphatic system. Yeah.
So I think because it's such a system that now is just really starting to become more recognized. And the lymphatics have been talked about for hundreds of years. And, the ones in the brain were actually discovered by an Italian anatomist, I think it was Mosconi, like 200 years ago. So it's been there. It's just that you put to the wayside, nobody even focused on it. And now that they see the relationship of the importance with lymphatics to brain health, I think it's going to get a lot more spotlight, pun intended, on it, that they'll start to look at how light may change the function, particularly in the brain. I know they say that 40 hertz of red light, infrared light in the brain is a really sweet spot. That was from the work of Norman Doidge and the brain that changes itself, because they use red light around here. I think it was a helmet or something that they did. And I've been using laser light and therapeutic light for 15 years, a huge part of my work, but I never directed it specifically to lymphatic channels. I was just using it over pain sites. But yeah, and then I actually have over in the corner of my home, I have a full body light bed that you lie in, and you can get different wavelengths of light, and I can change the frequencies of the light. That's how fast they pulse,
Wow.
which changes the response based on their pulse frequency. It's kind of like music. Music changes when you change the frequency. Then you have, of course, the infrared saunas. I have one of those too. I have a portable infrared sauna that I use from Therasage. And I go into that several times a week. You have to be careful with all of these. Like I said before, is that you figure, oh, that the infrared sauna must be great, so let me jump in for 45 minutes. Not so much. Okay. You got to go easy, because that can make you worse or slow down your healing process, because you have to deal with that stress of too much therapy. And not every system handles infrared therapy well in the beginning. And it's really hard to quantify who that might be. But that's why I tell people, just start off with something light, like 5 or 10 minutes, and see how you feel. And then you tiptoe your way in, what we call tiny little action steps, or TLOS, because you can always take another step forward. But once you're there and you jump, it's hard to pull back from it. But the infrared can do quite nicely for people. And so I do all of those different types, because I just want to have different ways to stimulate my lymphatic system, but also just the sensory systems of the body, because that's the way that your brain gets information, is through sensory input. So you have the sensory input from outside, that's called exteroception, outside of the body. And then you have another one that's called interoception, that's inside the body. Right? And then they find that the parasympathetic nervous system, the wine, dine, feed, breed one, really pays a lot more attention and drives it drives the bus, which means it steers everything more from an interoceptive type.
Okay.
What you feel inside, hence going back to the lymphatics, and two, also from your own thought processes inside. Right? Because you can just be sitting in a space completely by yourself and notice the physiological power of your thoughts based on thinking of a stressful event in your past. And then your physiology goes right back to it. And then you notice, holy cow, like I feel like I'm having an allergic reaction. That's because you kicked off your immune system from the very thought of something. Yeah. And you can take it the other way by focusing your intention and your attention and your awareness to something else. And then you're like, that's crazy. Now I thought of a different event, and then my heart rate changed, my flushing in my face changed. So that goes to show you the power of the mind-body connection and the emotional connection to chronic disease and illness. So there's you always have to be part of your own healing process, because you're ultimately in control of the story that you're telling yourself. So brilliant. But you have to be careful, because a lot of people are living a story that is somebody else's story.
Exactly.
And that's the what they call the quicksand that can pull you under, that you don't even realize is pulling you under. So that's where your environment makes a big difference. So we say that you cannot get well in the same environment you became ill within. And that means the environment around your cells, like your fish tank. It also means your mental environment, but your community. And community is a really big overlooked part of healing. Yeah. For yourself and for the world. It's your culture. It's your society. It's the small community that you have, maybe with your spouse or your parents and your family, because everybody's got messed up one of those, right? But then your extended community of your work environment, and even now with your Facebook environment, even the trolls that can come in and be part of your community. And I honestly think that if you look around in the world today, we have such a disconnect from each other as human beings and community. We're so polarized in these tribes, and we're paying a physiological and mental price for that. And especially with the pandemic, I think it's going to be far-reaching things that we just can't contemplate of the decisions that we've made and what we've just tried to do in a reflexive moment of fear and guilt, which people use to motivate behavior, especially in politics and medicine. That's the way they rule behavior, is to scare the hell out of you and guilt you into something if you don't do what they scared you for. And then that has repercussions down the line, and your immune system gets kicked off with fear and guilt and shame too. It's really cool research to show that they've proven that your inflammatory system, your immune system, goes into a cascade of almost like a cytokine storm that you get from shame. That's
incredible.
It is.
I've got to get that paper from you, because I think that's crucially important. Obviously a lot of emotional work my wife does as a wellness and health coach. And, I've also realized your close community, they carry a biomagnetic flow that's obviously going to help with your lymphatic system. It's going to help with your vagal tone. It's going to help with balancing your autonomic nervous system. And an incredible guy called John Levy, who wrote The Art and Science of Influence, talking about that your social integration and your social close ties are the greatest predictor of longevity. So these things are important. These things are crucially important. And as you said, it's really about holding people that really accept you for who you are and delight in you. And the closer those fields and those people come around you, I see people's health just thrive. So I think obviously that's very important with the lymphatic system and the autonomic nervous system. But let's finish up and let's talk about specific exercise. Is it high intensity interval? Is it more aerobic exercise? What is the ideal exercise to help someone with a lymphatic problem? And then if possible, I know it's incredible to connect with you, Dr. Perry, and we can do a later stage once we've got questions on the autonomic nervous system, the vagal tone exercises, which are absolutely incredible. I'm really going to punch your Instagram page and your channel. It's just, you're a man of abundance. You're a man of a person. You don't have a scarcity mentality like a lot of people do. You're just here to give and change and transform people's lives. And we can see that. I really can see that through your podcast and your channel. So it's incredible. Let's finish up with exercise or anything else that can help people's lymphatic system. They're sitting there, they understand they feel swollen, they feel puffy. Should they go for a lab test? What else can they do from Dr. Perry in terms of the lymphatic system?
Well, thank you very much. Very, very kind. Very grateful. So my joke, but my not joke is that you already took the first step towards changing your lymphatic system. You just became aware that you have one and that it matters and that you can do some things to take care of it, right? I have a phrase that I use that's called, you can't change something until you become aware of it. And that's a capital Y-O-U. Because listen, stuff changes all the time. You just don't notice it, right? But if you notice it and you become aware of it, then you can take the action steps to change it. And it doesn't take a lot of action steps either, right? So a lot of this is just based on you pulling that lymph thread and seeing where it takes you along the journey. That's called string theory, that once you pick up something, you realize it's attached to everything else in the universe. But so you start there. The best thing that I've found for lymphatics, one, is working those 6 areas that I told you. And then 2 is walking. Because we're designed to ambulate and move from one place to another. And I mean purposeful walking. Like walking where you have an intention and attention to go somewhere. And when you're walking, you're walking. It doesn't mean that you're looking at your Instagram channel to see how many likes you got. Because if you're focused in on this thing, first of all, you're probably massacring yourself with the blue light. 2, I can tell you that there's no way you're rotating your torso as much as you should be rotating, because otherwise you wouldn't be able to see your phone if you did. And you've always got a little bit of small excess tension in your body because you're really not aware of where you're going. And that excess tension decreases flow and increases the overall stress response. So walking with purpose means standing nice, tall, lean, mean, and confident, breathing through your nose, preferably as opposed to your mouth, using these things called arms and legs, and having a nice full stride. Change your stride pace. Try to get a little bit more speed walking in, so you look kind of a little bit silly, like you're going. And just put some music in your ear and then start to sing and hum at the same time, and then you get nice vagal stuff kicking in at the same time. Try walking on different terrain, which means go uphill, go downhill, go up the hill sideways, walk backwards, karaoke, kind of twist and turn side to side like you see the football players do on the field when they're doing this way. How about skipping a little bit? That's kind of nice. Skipping is awesome. And I guarantee you might feel a little ridiculous the first 10 seconds, but after that, when you get out of your own head, you'll probably be smiling and laughing, I guarantee you. And you'll realize, holy crap, I'm out of breath. That's a great high intensity cardio move. It's self-limiting, which means, trust me, people can run awful for a long distance and not know it. You can't skip a long distance. So it's self-limiting on the damage you're going to do to yourself.
Yeah.
Plus it's fun and you get twisting and turning and rotation. A lot of people will remember, holy cow, I forgot how to skip, because they forgot the coordination and the cadence that goes with it. And then you can do your rebounding. You don't need to buy a rebounder. You've got ones built in. They're called your calves. So you just jump up and down on the balls of your feet, but you do that easy too. Don't completely leave the ground when you jump off of it. You just stay on the balls of your feet, which is close to your toes, and you let your heel come up like you're doing really fast calf pumps like this, just jumping up and down. It'll be easier on your knees, easier on your ankles, and easier on your sacrum and your spine, because a lot of people might not be able to tolerate that bounce and they can't absorb pressure well from the descent. So it's called the deceleration phase because they're just not used to slowing down movement. So you start off easy that way. That's probably the easiest way that I can tell people to start. I give them things ridiculously simple, but they're basics and fundamentals for a reason, almost stupid simple, because a lot of people just get overwhelmed because the sheer amount of things that they're told to do or should do. Sometimes that immobilizes them because they just don't know where to start, or they're scared of doing something wrong. And I don't believe in right or wrong movement. There's no such thing. There's only different movement, because movement is context and task driven. Like there may be times when you have to bend over and twist and turn to get underneath a log or get around something that you wouldn't do if you're squatting with 500 pounds on your back. Yeah. But it doesn't mean that that movement is bad. And a lot of people get so fearful that they're moving wrong that they don't move, or they don't move unless somebody's there to tell them that they're doing it right or wrong. So once again, you cycle back and you feed the stress response. So why don't you just move like you used to move before the world started judging you for every damn thing that you do? Why don't you move like when you were a kid?
Yeah.
Why don't you just play, right? And then when you played, you played. Great a game of tag is probably one of the best things you'll ever do to heal your life, right? And here's the beautiful thing about play. It's nature's built-in way to make you more resilient at everything that you do. We just don't do it anymore because we take ourselves so seriously, or people say that play is not serious. Well, I got news for you. You should look around and see how the world is doing with all these super serious approaches that we're doing in medicine and healthcare and therapy. It ain't going so good. Maybe you should go back to what nature already built into you, because nature's not stupid. She's really smart. She never does anything without a reason, right? And the further you get away from nature, the more lost you will become.
Yeah. Wise, lots of wisdom, lots of value there. You've got a big fan here in Johannesburg, South Africa, African pro biohacker in the form of Steve Stavs, Dr. Perry Nickelston. What a channel. Stop Chasing Pain. That's his page on Instagram. Stopchasingpain.com is his website. He's got workshops for professionals, for human beings, those that are interested in improving their health, optimizing their health, those that are sick, those that are well. So I salute you. I declare favor and blessing over you, that you would have the courage, that you would have the strength, the energy to fulfill the purposes and plans that you have for your life. I thank you. I really am grateful for your supernatural sort of gift that you're using and your time. And I look forward to having you back on. The one and only Dr. Perry Nickelston. Thank you so much.
Thank you very much, my friend, and everyone for listening.